Hey everyone, it's Dr. Cassidy from CHIRO for Chiros. Today I am giving you tips and tricks for talking to your patients about your cash practice policies, aka using cash, paying with cash instead of using insurance. There's a lot I can say about this topic. It's really challenging and there are a lot of bumps that people encounter along the way. For all intents and purposes, we are going to need more than one video to cover all the things. This video in particular is going to cover how we can talk to the new patients that have just found us coming in, how we get them to still schedule that appointment, even though we are a cash practice. For all intents and purposes, and to really simplify this video, we are going to start at the point when you have a potential new patient that is ready to click that schedule here or that call button to book their appointment. So in our clinic, there are two different ways that you can schedule as a new patient. One is online, the other is by contacting the clinic. That is usually by a phone call. So let's cover the first thing, the easiest thing first, and that is the online scheduling. When someone goes to schedule online, it is imperative that you have your pricing very transparent, very transparent. We have ours listed, price and appointment type. They know the price before they even pick a time. And then if they are a new patient, let's say they missed that little price tag on that first button, in order to reserve their appointment, they have to put a credit card on file. So that small detail requiring that small snippet, we don't charge when they reserve their appointment. We just reserve that credit card number. Naturally, we'll send off alarm bells if for some reason this new client doesn't already know that we are a cash practice. As I mentioned, it's just a card that gets reserved to their file, so they aren't charged any amount when they reserve their appointment. Furthermore, we don't have a cancellation policy, so we won't charge their card unless they show up to their appointment, we deliver our care, and then we will charge them for that care. Typically, we just go with the next business day, but whatever your policies are. Second way that a new patient can book with us, and I would argue the most common way that people make appointments at most clinics, is over the phone. So what tips do I have for you when you have that new patient calling in to schedule an appointment and you need to be transparent about being a cash practice, especially if you don't do any insurance? So you have a potential new patient on your phone and you've greeted them. Maybe you've made small talk, this, that. They want to schedule an appointment. What do those next steps look like? For us, I say something like, I'd love to get a few details from you before we find an appointment time that works. I always get their first and last name and a good email address, also a good phone number to reach just in case that phone call drops. If the person calling doesn't already know that we are a cash practice, the question inevitably comes up when they're making an appointment, any kind of healthcare appointment. The question will come up because if we aren't asking about insurance information, they're gonna be wondering why. So the question comes up, do you take insurance? And we simply respond, unfortunately, no, we are a cash practice. We accept cash, HSA, and FSA. As simple as that, just a flat answer. There's truly, no wiggle room. It just is what it is. And we're super upfront with that information. With that answer, we get one of two responses. The one being the go ahead to go schedule that appointment. Maybe they have some extra questions about pricing, or we get the response of, oh, that doesn't work for me. I would like to use my insurance. And instead of getting frustrated in that moment or, letting that new patient totally slip by, use that information that you got from them right away on the phone and offer something useful. What we do is we keep a list of practices that are similar and dissimilar to ours who do take insurance. So we can say at times like these, if you'd like, I can send you our referral list for local chiropractors who do take insurance. I could just send it to that email you gave me earlier. If sending a local referral list doesn't feel good to you or doesn't feel like something, that resonates with you, then take advantage of all of your online resources that you have for your patients. I will give an example. Let's say we have a mom on the phone who's calling. She's dealing with low back pain and trying to see a chiropractor, decides that we're not a good fit because she would like to use her insurance. Knowing just that basic information, we could email her a helpful link to our low back pain stretching playlist on YouTube. She would have a variety of videos, stretches that she could go through. She would continue to see our face. She would continue to hear our doctor's voices, get to know us even better. So if she doesn't get better at a different clinic, then she will know who she can come see. The cool thing about being helpful and unique, making an impression, simply by providing resources that you already have planned, can lead to some pretty incredible things. What we see a lot in our clinic is the patient or that potential new patient uses our resources. Maybe they even go see a few of the chiropractors on that referral list. And ultimately, they still end up making an appointment with us, which is incredible. Absolutely incredible. Because ultimately, they understood that we just want them to get better. We don't care if it's our hands doing the work or if it's Joe Schmo down the road who takes insurance that gets them better. That's not the point. And it's also not why we are taking cash, right? We're not exploiting them. We just want them to get better. So with all that being said, that's how we approach our new patients and explain to them our cash practices. We understand that not all of your experiences are going to be like ours. So if you have any extra tips and tricks, be sure to leave them in the comments. And if you have questions, we'll get to them next week.